Good afternoon, and thank you for joining us on this snowy December 16th. On behalf of the Kensington Falls Church and the Kensington Reston Senior Living Communities, I'd like to welcome you to this special presentation today. I'd like to introduce our moderator for today, a gentleman who needs no introduction, Mr. Steve Gurney. Steve is the founder and publisher of Positive Aging Sourcebook and the Pro Aging Network. Steve, thanks for joining us and doing this with us.
Oh, thank you, Susan. And I'm delighted to be involved in such an interesting and relevant discussion right before the holidays. The Kensington really put together a great panel here, and I'm delighted that you invited me to serve as a moderator. And I'm really excited to jump in and learn more from our panel members. But I'm in Reston too. This is not what my office really looks like, but can you believe it's snowing today?
Oh, it's fantastic, isn't it? I mean, everybody is at home. I hope they're having a hot cup of soup and they're able to watch this wonderful program and aren't on the roads. What a wonderful opportunity for people to learn, as you say, a little bit more about this important subject. So I'll let you have at it, and I'll see you at the end.
Oh, without a doubt. And yeah, as Susan had just mentioned, we're not on the roads. Just think about it, guys, if this was in the pre-COVID world, this event would be canceled today, and it's not. And I think that one of the benefits of the changes that we've made is that from here on out, we have the ability to have panel events, and even when the vaccine comes out and we can go back to having live events, we can also pivot very quickly and say, hey, it's snowing today, let's make this a Zoom event instead of a live event. So that's real exciting. Well, we're coming up to the holidays, and the holiday season has never been more challenging for those of us who are either planning or caring or thinking about our loved ones and their elder care issues. And so that's the topic that we've got today. And we've got an amazing panel that the Kensington put together here. I'd love to welcome them on. Let's get to know them a little bit better. We've got Dr. Sinha, who is got a very innovative medical practice. We've got Susan Rannick, who is a certified clinician and speech language pathologist. And we've got Vanessa Bishop, who is an aging life care manager. And so let me welcome these panel members on here, and let's get to know them a little bit better. And let me start with you, Vanessa. The term aging life care manager is something that a lot of people aren't that familiar with. And you've been running your practice, Elder Care Consultants, for many years.
Right.
Tell our audience a little bit about you and your profession.
Absolutely. And first, thank you for having us all on today. I'm really excited to be here. Elder Care Consultants is an aging life care management organization that was founded in 2002. And we truly have a very interdisciplinary team of care managers comprised of registered nurses, social workers, certifications in care, in case management, rehabilitation science, and really a very diverse team where our work here, history and experience just is very expansive. And we work with the older adult, seniors and disabled adult, and we service Northern Virginia and the District of Columbia and Montgomery County, Maryland. And a big main hat that we wear is advocate for our seniors.
Great. And for those of you who are tuning in that might be outside of those regions, I know these digital meetings have a tendency to get people from all over the world. The cool thing is that, Vanessa, you're part of a national network of aging life care managers. So if you've got a friend or a loved one in Des Moines, Iowa, Vanessa might be able to hook you. I hope there's an aging life care manager in Iowa that you could connect them with. Just a little bit curiosity, like tell us a little bit about your background before you became an aging life care manager. What was your profession and what led you into this profession?
It's a great question. So I have my master's in social work with a concentration in individual adult mental health. I'm also a licensed clinical social worker practicing in all 3 jurisdictions. And prior to establishing Elder Care Consultants, I worked in long-term care nursing facilities, or you might hear the word subacute rehabilitation or skilled nursing and rehabilitation facilities. And my passion as a social worker is really to advocate and service the older and or disabled adult. And I found that being an aging life care manager, I'm really able to provide customized care management and advocacy for my client, that individual. So long-term care straight to aging life care management.
Great. And yeah, I mean, folks in the audience, having an aging life care manager is very on this call is fantastic because they see the decision-making process and the problem solving from so many different points of view. So I'm delighted that you're here. And let's jump to Susan Rannick, our next panel member. And before we get to know Susan a little bit, I want to just let the audience know now that everybody's got their seat in the Zoom room, just a little bit of housekeeping on how you can make your experience the best it can be today. First off, down at the bottom of your screen, you'll see the little chat box. That's a great place for you to interact with the other attendees who are here today. So feel free to introduce yourself. And throughout our conversation today, if you've got a challenge or something that you're trying to figure out, chat is a great place to put it, because what you'll find is I see the attendee list. We've got folks that are looking for themselves and sort of using this as their own family solutions. And we've got some other providers that are in the audience that might be able to help you through your challenging situation. So use chat that way. And then the other thing that you can use is you can ask a question of our panel at any point in time during this discussion. All you got to do is just type it into Q&A at any point in time. You may have tuned into this and you've already got a list of questions. Feel free to type them into Q&A. We really want this to be an interactive conversation. And so you can do that as well. And then throughout the day, throughout our session, if you would prefer to ask a question as opposed to typing it in, you just want to ask it, you can do that as well by raising your hand, by pressing the raise hand button down at the bottom of the screen. And then when it's appropriate, we'll bring you on. And don't worry, we're not going to see you. We're just going to hear you. So doesn't matter if your hair and makeup isn't perfect today. So sorry about that long-winded statement, but I want to make sure that we make this as interactive as possible. So now let's jump into one of my good friends for many years. It's Susan Rannick, who's a certified clinician and speech language pathologist. Susan, tell us a little bit about what you do as a professional and how you kind of landed in this profession.
Two-part question. Question. Well, I would be remiss if I didn't say my name is Susan Ironic, as in isn't it ironic? That's how everybody remembers me. I'm a board-certified speech-language pathologist. Speech-language pathology, together with social work, I think those are two of the least understood professions in the medical field. Speech-language pathologists work from neonates all the way to end of life. And my area of focus is adults and older adults. We work with speech, with memory, and swallowing. We handle all of those issues. I too am licensed to practice in Virginia, Maryland, and the district. I specialize in people who have neurogenic diagnoses, and to speak English, that means people with Parkinson's, people with ALS, people recovering from stroke, and the dementias, as well as will to live. That's my big thing now, getting people excited about life. What else
Right.
did you ask me, Steve? I teach,
Oh,
I don't use
you
it.
know,
You wanted to know how I got
think that,
started.
yeah. How did you get started in this profession?
This is an interesting story. I spent the first 30 years of my life, this is a second career, I spent the first 30 years of my life working for the Italian Ministry of Defense, legally. I was a translator, translators write, and an interpreter, they speak. I did the bulk of my work in translation, but as such, I had the opportunity to work with over 128 countries and cultures, almost as many languages. I was the only female American civilian in my position. I worked directly for the attaché, and I amassed quite a bit of knowledge on cultural communication, gender communication, miscommunication. So after that, I decided I wasn't going to go much further, you know, being a female civilian. So I wanted to get into the medical field, and I went into speech language pathology and wound up, I have provided therapy in 7 languages, including swallowing instruction in Chinese. It's
Wow.
not my language, but you never not treat somebody, as I'm sure Dr. Sinal will verify. You don't not treat somebody because you don't speak their language.
Yeah, and today, as we're going to learn, I mean, part of this whole elder care challenge is communicating with our loved ones and our families and the medical practitioners. So it's awesome that you're with us on the panel. And I don't want to put you on the spot, but and I'm not sure how your Italian is, but can you say Happy Holidays in Italian?
Certo che sì. Buon Natale a tutti.
Whoa, that is beautiful.
I migliori auguri.
That's great. All right. Well, let's jump to our next meeting, our next panel member, and that's Dr. Sinha. And Dr. Sinha, if you're not familiar with him, he's got an innovative practice based in Northern Virginia, Bellevue Medical Partners. And he has really done a great job of adapting his practice in this pandemic. And Dr. Sinha, we're delighted to have you on board with us, because any of these discussions that I've been a part of, if we've got a doctor, there's lots of questions and information that you're able to provide our audience. So tell us a little bit about your practice, and then I same question that I asked of Vanessa and Susan. Would love to know how you came about specializing in this area.
Sure. Thank you, Steve. Great to be here. Welcome to all the panelists and everybody watching. So my name is Vivek Sinha. I'm a family medicine, board certified family medicine physician, co-founder of Bellevue Medical Partners. We are a house call and office-based practice here in Old Town Alexandria. We see patients wherever they need to be seen, whether it's here in our office, whether it's through telemedicine, or whether it's in their house, whatever they call home. If home is an assisted living community or a memory care community, or if home is their actual home, we'll see them there. So we've been doing this for the last few years, and it's been really exciting. And the one thing I've really learned again and again is that medicine is fragmented, and it is a multi-specialty field. And so I'm grateful that we have our panelists with their expertise involved in this. As far as how I got involved, I got involved in medicine because my father is a physician, and actually I think he is listening to this in New York, Long Island right now. He lives on Bellevue Avenue with my mother, which is why I call it Bellevue Medical Partners. So I practice healthcare, practice office-based medicine for the first part of my career. I've had a little bit of an interesting medical career. I was a firefighter for a few years and worked with disaster medicine in the federal government. So, I started thinking that if we can bring world-class care to a field hospital in a tent in a Best Buy parking lot during the aftermath of a hurricane, why can't we bring healthcare to people in their home when they need it? So together with my business partner, we started planning a few years ago, and we haven't looked back since. So excited to be here.
Great. Well, welcome all three of you, and welcome to our audience. And Dr. Sinha, since I'm on the screen with you right now, why don't we jump into some tips and guidance that you'd like to share with the audience. And again, I would just like to remind the audience, let's make this interactive. So if you've got questions, comments for any of the panel members at any time, just type them in and let's get going. So really excited to hear what you have to share today, Dr. Sinha.
Sure, thank you. So I'm going to start off very briefly for the next few minutes, just by starting off by asking a question. You know, why is it that you rarely see EMS or ambulance personnel running to go treat their patient? You know, I'm sure we've all seen an ambulance arrive to a critical emergency or a car accident, and you know, we've seen the paramedics get out, but usually they're walking quickly, but they're not running. They're walking briskly, purposefully, usually quietly. They're not screaming, running to their patient. Why is that? You know, why do we, when we get in the pre-COVID world, when we would get on an airline, we would hear that we should put our oxygen masks on first before helping others. During the pre-flight briefing, they would announce that we should not help anyone unless we place our mask on first. So what they're saying, if my 8-year-old son was with me and if the O2 mask dropped, that I should put my mask on first, even if he's panicked and scared. Why is that? And then why is it that when we teach CPR to medical students and resident physicians, we always ask them, what is when called to the scene of a critical patient, what is the first thing that you check? And 100% of the time, the answer is, well, you check the patient's pulse. And 100% of the time, the answer is wrong. It's you check your own pulse first. Well, why is that? So I think emergency personnel, airline personnel, hospital personnel know that unless you take care of yourself, you go from being the caregiver to the patient. And that's why you don't see EMS personnel run. Running raises your heart rate, it decreases your peripheral vision, increases the likelihood of you getting hurt, all of which would prevent them from helping the patient. It's the same reason why airlines want us to put the mask on ourselves first. It only takes a few seconds, but loss of oxygen can cause us to black out in seconds. And if your child has their mask on, but you're passed out, you can't help them. And it's why trained hospital workers will take a pause before jumping into a critical situation. Taking your pulse, it only takes a second, but if your pulse is fast, it forces you to acknowledge that your judgment may be compromised and to take a deep breath. So in some way, shape, or form, everybody on this call is a caregiver. Whether it's your spouse, your parent, your sibling, your friend, your neighbor, there's somebody who depends on each one of us here. So unless we approach caregiving the same way as our EMS personnel, as our hospital staff, or as our airline personnel, we have the potential to become the patient rather than the caregiver. So what happens in the mind is reflected in the body, and what happens in the body is reflected in the mind. And that's the thesis of what I'd like to talk a little bit more about later today.
Oh man, this is great. And you hit the nail on the head. I mean, at Positive Aging Sourcebook, normally when we receive a call, it's somebody who is just frantic, they're stressed out, and it's very difficult to make decisions when you're in that state of mind. And I love how you articulated that. That's fantastic. So we will jump back to you. And actually, we had a question from Jennifer Brown. She was wondering, where in Long Island did you grow up?
I grew up on the East End. Since if you're from Long Island, you know that we describe where we grew up based on our exit off the Long Island Expressway. So I grew up off exit 69 off the LIE in a small town called Center Moriches.
On Bellevue Avenue.
On Bellevue Avenue, yes.
I love it. Great. Okay. And yeah, folks, you can ask any questions or share your thoughts anytime throughout the event. So let me kind of move back to Susan Rannick. And Susan, what words of wisdom do you have to share to help us prepare for this challenging holiday season that is already upon us?
My words are that everything about you speaks. What you say, how you look, what you do, the speed with which you do it, and the words you use. And the most important aspect of all of that is what the other person understands. This is critical, especially during the holidays. We are all creatures of habit, and the COVID chaos, which is how I refer to it, has upended our routine. So it's important for us to establish some sort of routine. People might be a little bit more nervous, a little bit more stressed, especially people who are dealing with challenges such as the dementias, memory issues. We're all a little bit challenged, and we're working very hard to restructure our environments. So I'd like to talk about communication, some of the whys, some of the hows, what to do's, the importance of staying calm, to hearken Dr. Sinha's comments. Stay calm, carry on, and I would like everybody to focus on the 3 words, the abbreviation TTS, target the smile. Target the smile, that's what determines quality of life, and that's the name of the game. When you're attempting to communicate with somebody, you want to see them smile. When I work with a new patient or a new client, the first thing I check for is, are they smiling? Will they smile? What does it take to get them to smile, and how long does it take to get there? That's the issue. With communication, there's certain things that people need to remember. It's important. People have difficulty expressing themselves verbally, especially with memory issues, but they also have difficulty processing what you say. They have just as much difficulty coupling what your message is to what their understanding is. So it's important to be patient. It's important to remember that they will not remember, and to be tolerant. Don't forget to breathe. And I can't stress the smile enough, because it releases the hormone serotonin that determines your feeling of well-being. If you laugh and you smile, you can't be stressed. Nobody smiling or laughing is stressed. And that serotonin, that release just by a simple smile, which we sometimes even call a grimace, it also releases natural painkillers, natural endorphins. But the serotonin goes up here. That's your mood center. So I like to refer to smiling as free drugs. So I'm going to encourage a healthy dosage of free drugs. And I'm going to remind people that the person with a memory challenge is always right. Remember that. You're going to their world because they can't come into ours. And it's important to remember that you'll always be a guest in their world. Remember that behavior is communication, not only theirs, but yours. You can keep yours in check. They might not be able to. And remember that confusion leads to agitation. So if you keep it simple, you'll keep it smooth, and you'll smile. And that's the name of the game. It's all about quality of life. That's what I'd like to talk about today.
Oh, that's great. You really brought up some great talking points, and it's, talk about challenging times that we're in, and the smile is that we're wearing these masks, and so when you said that, I happened to reach for this mask that I have that enables you to see somebody's smile. But I also love your point about the person with dementia is always right. It's sort of like we're all used to the moniker, the customer's always right. And those retailers that practice that are the ones that win. But I think that if you're in a situation where you're caring for people who have dementia, those are very well-spoken words, that they're always right no matter what. And we have to figure out how we're going to behave around those individuals. So great points to kick us off. And so let's move to our next panel member, Vanessa Bishop, Aging Life Care Manager, who, what a fantastic profession. Again, to our audience, if you're not familiar with the profession of aging life care, it's absolutely amazing. What can you share, Vanessa, to help us get through this challenging holiday season?
Well, first and foremost, understanding the whole picture when caring for an individual is critical and can be difficult when you're an active caregiver. And it can be an exhausting experience and journey. And an aging life care professional can help an individual see the whole picture and lay the foundation for building a successful support team and provide you relief during this holiday season. And, as an aging life care manager and professional, we assist in helping an individual see the whole picture. And that first step is conducting that comprehensive assessment, seeing where the individual is medically, psychosocially, environmentally, and really during this holiday season, areas of particular focus as an aging life care professional and helping seniors or disabled adults or family members during this holiday season, is caregiver burnout. We've had that pre-COVID, during COVID, post-COVID, and it's so important to know that we're problem solvers and we can help assess the caregiver for the degree of burnout and provide recommendations in alleviating the burnout. Assessing when is it appropriate to bring in supportive services like private duty? When is it appropriate to really consider alternative placement during COVID? Areas in which, again, we serve as a support, and for the individual to recognize is periods of prolonged exhaustion, difficulty sleeping, lack of appetite, irritability, anger, resentment, and frustration. Again, we serve as a guide and support to the caregiver during this really tough time in all of our lives. And areas in particular focus that we find ourselves being called upon, again, to be of support to the caregiver and the senior during this holiday season, is assisting families and clients in determining what is meaningful about the holiday season to them this year. That's so important because it's so different this holiday season. Assist in weighing the risks of an in-person versus a virtual visit. We are definitely being called upon to help serve as a guide and support, and realizing that it's okay to do a virtual visit. Understanding that emotionally this year, it might be overwhelming for them to visit in person. And it's also to monitor our emotions as a caregiver, helping guide the individual, the caregiver on that, monitoring for isolation and leading to depression and anxiety, and resources and supports that we can put in place, again, for the caregiver to lessen that, to mitigate, to alleviate that. And really thinking outside the box in the sense of assisting families in celebrating the holidays with their loved ones, whether long distance or local, being creative, things that we've been recommending, drive-by car holiday celebration, baking goods, sending cards to lots of family members, a lot of virtual technology being set up that we can assist in facilitating, and programming, a lot of programming. And there's just so much as an aging life care professional that we can guide the caregiver on. And it's so important to say to yourself as a caregiver that no situation is static, that it's truly an ongoing assessment. And there really is no shame in asking for help, because it's truly a team approach. And we're just one of the experts on the team to help guide and support.
Great. You brought up some great bullet points that we can dive into a little bit deeper. And again, I want to remind our audience, if anything, that all three of our panels sort of triggered a topic that you'd like us to dive into more deeply, just either raise your hand and we'll bring you on audio, or you can type in the Q&A box. But Vanessa, one of the things that you sort of touched on is communication amongst family and making decisions, and the willingness to sort of open up the idea that you could bring somebody else to the conversation to help. And this is where I regularly refer to aging life care managers, is the calls that I get where, my brother thinks that we should do this with mom, and I think we should do this, but mom really wants to go to Bob Evans and celebrate Thanksgiving or something like that. Having an objective third party navigate that family discussion can be pretty powerful. Have you seen that in your profession?
Absolutely. And that's where it goes back to looking at the whole picture, doing the comprehensive assessment of the individual, which I can certainly go into detail later on, and really educating and serving as a guide to the family members and validating and acknowledging their thoughts and feelings, goals, wishes, desires, losses, and to try to, I'm a big believer in thinking outside the boxes is it's okay to say no, and how can we make this a successful visit, and creatively bringing in resources to be able to celebrate that. And they look at that neutral third party that happens to be an expert in the field, whether it's a social worker or a nurse or a physician or Susan, speech pathologist. They're looking to us to be that guide for them.
Yeah.
Absolutely.
No, that's great. And another thing that you touched on is visits. I mean, many times what we are focused on in the holidays, pre-COVID especially, was this is a time for us to get together, and we might not see our loved ones at all year long, but we know we're going to get together and give them a hug on Christmas, in the holiday season. Dr. Sinha, I think this is a great opportunity to sort of get your take on this world when you hear that one of your families is thinking about an in-person visit. What words of wisdom, what guidance do you give in terms of testing and, if they aren't going to make this remote, if they depend on getting together face to face, what guidance can you give us from a physician's perspective in that regard?
Sure, that's a really, really important question, especially now. I've commented that, in the last 8 months, I think we've all aged about 18 months. And, COVID has it's been a game changer from every aspect of our lives. And, I often use the term or the phrase risk versus benefit when we're prescribing any medication, when we're performing any sort of medical treatment. I found myself repeating that phrase over and over and over again this year. So everything comes down to risk versus benefit. Yes, there is a risk to seeing somebody face to face, but there's also a benefit. So if the risk is outweighed by the benefit, then you should proceed cautiously. And really, you're the only one that can decide that. So some good rules of thumb that I recommend to people is that social distancing is by far the safest thing when you're trying to avoid COVID. But if you cannot social distance, that's where masks come into play. And ideally, both people are wearing masks, and then you're still trying to be in either separate parts of the home, or ideally you're meeting outside, maybe in a garage with the doors open and bundled up, maybe not today when it's snowing, but really being cognizant that if you're having any sort of upper respiratory condition, any cough, runny nose, whereas normally we would say, well, it's probably just a virus. Now we're saying it's probably just a virus, and the phrase virus means something different this year. So being very, very careful, washing your hands. I wash my hands about 75 times a day. So really being cognizant of one another. Now, as far as people who with dementia or cognition issues, it is important. Isolation is very, very dangerous, and we're seeing a lot of people decline very rapidly. So there are, as Vanessa had said, there's some outside the box things that you can do. There's drive-bys in the car. There's sending mail. I've had I've heard some great stories of pen pals coming back into play, where you're sending handwritten letters, and there's ways to make that connection, and it's individual for everybody, but we just have to think differently, at least for the time being.
Great. Now, just out of curiosity, what are your, when you're I guess you call them patients, your clients, when your clients call you and they're concerned about COVID, what is your approach to testing? Like, when do you test, and and what are your thoughts on the accuracy and how you use that in decision making?
Sure. So if I have a patient who calls requesting a test, I classify them into two different categories. Are they symptomatic or are they asymptomatic? So if they're symptomatic, meaning they have symptoms of an upper respiratory or a lower respiratory infection, I then further classify them into, are they very sick? Do they need medical intervention? Or are they, they're not sick and they're able to stay at home? If they're not sick and they're able to stay at home, the CDC has recommended that, regardless of what your test shows, you should quarantine for 10 to 14 days, although that number may be changing a little bit. However, it does come into play because we do have a lot of patients who are also healthcare workers, and it's important for them to know if they're symptomatic, they may not be able to stay home from work for up to 2 weeks. So there may be times when testing is absolutely necessary, especially if there's caregivers, and if you have a person that you're caring for in your home and you're feeling symptoms, you may actually need to be tested. So there's a couple of different types of tests. There's the rapid antigen test where you get the results within 15 to 20 minutes. And then there's several PCR tests that take about 1 to 5 days to come back. Typically, the PCR tests are a little bit more accurate than the rapid test. And then when you get the test done is important as well. So if somebody was, not that they should be, but if somebody was at a big party with 100 people and they on Monday and they find out that on Tuesday somebody was positive for COVID, them getting that test on Tuesday probably is not the best thing because it takes several days for that viral load to build up in your body so the test can be a true positive or a true negative. So the bottom line is it's having an open dialogue with your provider, with your physician, with your PA, with your nurse practitioner, asking for good medical advice from them is very important.
Great. And then a question just came in, and I'm not sure if you've had the opportunity to evaluate this, but how accurate are the new rapid home tests?
Sure. So there's on the market, there's tests that can be done at home. So all tests come down to how is the sample obtained? Was the sample obtained properly? And was the sample processed properly? And that can be said for any test. I've seen different medical personnel get flu swab samples that maybe weren't the best, and then I've seen samples that were done very well. So as long as the sample is obtained according to the instructions and done properly, and if it's a PCR test, we have to assume that it's fairly accurate. But we also have to think about at what point in that timeline did you get that test? I've had people with multiple false negatives, and then the third or fourth test has been positive. So it's a moving target. Go by symptoms and then go by what your provider is telling you.
Great. I want to jump back to you, and I'd love your thoughts on the vaccine. So I'll give you some time to think about that. I'd like to jump back to Susan Rannick, because Susan, I love what you were saying about the goal is to put smiles on our family's face and the people that we're working with. And one of the things that I've found is that when we're talking about healthcare challenges and people having to sort of reinvent themselves if they're not feeling very well, that putting a smile on our face is a difficult process. But I understand. I'd love for you to dive a little bit deeper on tips that we can use when we're talking to our loved ones and those we're caring for that could help keep that smile on their face.
Well, I stay focused on the last three things. If I had 3 seconds to communicate with somebody, and I speak as a colleague, I speak as a clinician, and I speak as a former caregiver. And if I had 3 seconds to say the last three things in the world to somebody, it would be, I love you, thank you, and I'm sorry. So try to bear those things in mind when you're dealing with somebody. And it's not about the facts, it's about the feelings. And communication isn't nearly as important as communion. Communion is the art of being one with. Martin Buber, a rabbi and philosopher, spoke about this many, many years ago. You can only experience communion with somebody that you really know well, like partners, spouses, family members. And instead of entertaining people and worrying about the idea is to keep people calm and engaged, to provide them with purpose and to provide them with some satisfaction and choice. And sometimes you can do that without going through great somersaults. Try anything, the sensory. Music is great because you don't need any mediation. You don't need words. You can just enjoy that music together. A lot of the networks, everybody's on Netflix and cable these days, and a lot of those programs have music channels. That's great for memory. It triggers smiles. It gives a little background. You can have a little conversation. Sometimes just doing a hand massage or being one with that person. You don't really have to do great things. Just try to communicate with that person and be calm and check your smile as well as checking their smile, because it's important for you to be together in communion.
You know, I love, and I didn't write it down, but it's, I love you and I'm sorry. What's the other one?
Thank you.
Thank you. Imagine, I've never looked at it from this perspective, but if you went into every meeting, family event, client event, with those three words in the back of your mind, no matter how challenging you know it's going to be, I think the outcome is going to be 100% better than the alternative. And we see it so many times. It's sort of like, oh, I'm really dreading talking to my brother about mom, you know? But if you went into that with, I love you, thank you, and I'm sorry, I think the outcome would be a lot better. What do you think, Vanessa? You're dealing with a lot of family dynamics. I don't think those three words and phrases are in the back of minds.
No.
The typical elder care situation. So that's a really good one, Susan.
Right.
And
three beautiful words, three beautiful statements.
Yeah. You know, Vanessa, you sort of opened the door on family gatherings. I'm curious, do you have any sort of, since we've got through Thanksgiving and now we're sort of moving to Christmas and New Year's, any sort of solutions that families that you've been working with that you thought were just really creative and worked really well that the audience might be able to employ for the upcoming Christmas season?
A lot of creativity from a virtual component is going on. I mean, I have family members that will be baking together virtually, will be singing together, caroling together, encouraging neighbors for loved ones that, let's say, are living in their home environment with private duty, encouraging neighbors outside that are decorating their homes for the senior to be able to look out the window, to be able to celebrate that way. A lot of creativity. Again, the drive-by, the celebrating. There's so many apps like the GrandPad, virtual video calling, a lot of writing, multiple holiday cards being received, the pen pals, just an enormous amount of creativity that we're seeing. And then there are family members that are choosing to come and visit. And so what we are doing is creating checklists, protocols, ensuring the CDC, guidelines and regulations, and having an understanding about the risks possibly involved, but an amazing amount of creativity.
Yeah, and sort of combining what you just stated and what Dr. Sinha stated and the risk reward, one approach that people in the audience might think about is, instead of let's say mom isn't as comfortable on technology as she'd like to be to really participate in the family gathering, perhaps it's one family member goes to mom's house so that the risk is minimized. Now it's just two people together instead of 10 people.
Correct.
And that one family member is sort of operating the tech so that mom can engage, with the rest of the family.
Absolutely, or even a caregiver in the home setting that prepares that special meal, you know,
Mhm.
that senior or disabled adult really enjoys, kind of being that role of that family member. Yeah.
Yeah, I love it. And okay, well, I'm going to jump back to Dr. Sinha because I'm curious at his thoughts on the vaccine, which is screaming from every headline out there. But I wouldn't be a good moderator if I didn't sort of ask the question, what of a doctor on this call, what do you think of the vaccine and how can it impact our current and our future?
Sure. So if I was building a house, I would use a hammer, I would use a screwdriver, I would use a saw. And you need all of them in order to complete your project. The vaccine is an integral tool. It's an integral piece of a very, very big puzzle. So whenever I talk about the vaccine, I always say that it's not in lieu of hand washing. It's not in lieu of wearing a mask or socially isolating or distancing, I should say. It is a very important piece of the puzzle that's hopefully will bring us forward. So that's important to know. You know, the vaccine is exciting. I have not had it yet, but I will run and roll up my sleeve the moment that it's available. I often, you know, patients will often ask me, hey, doc, what would you do if I were you? I think a better question is, what would you want your children to do? So I would definitely have myself vaccinated. I feel comfortable having my kids vaccinated. It's an individual answer. Now, there's a lot we do know about the vaccine. There's a lot we don't know also, and there's some very real concerns that I think people are valid. We don't know exactly how it affects women who are pregnant yet. Unfortunately, there's just not enough data. We do know that there's a risk-averse benefit, and the risks of COVID are very, very real, and it's affecting a lot of people across the world. And there are risks to the vaccine as well, but the individuals have to determine for themselves, where is the risk of the vaccine and where is the risk of COVID, and at what point do you see a risk versus reward benefit. So that's the advice that I normally give to people if when faced with the choice of, do you get vaccinated or do you not get vaccinated? It's a personal decision, but it's one that I've decided, and my family have decided to get as soon as we can.
Yeah, no, yeah, it's going to be really interesting 2 or 3 months from now to sort of, we're recording this conversation and we can go back and, gosh, remember when we were just talking about it there in December. Yeah, and it'll be really interesting to talk to an elder or somebody who has received the vaccine. I'm sure we're about to start hearing some conversations from folks like that.
Yeah.
But,
we go to a lot of elder care communities and memory care communities, and you know, we're ramping up probably this week, maybe next week. Hopefully this week we'll start giving some of our older residents the vaccine, and you know, there is a lot we know about you know, side effects and how often it happens. Most side effects are fairly minimal: headaches, fever, injection site. You know, usually presents within the first 3 days. When it does present, it only lasts about a day or two. So even though it was the timeline was compressed, there was still a lot of research that was done, and the important components were not compressed. Everything still went through the proper protocol.
great. Well, I just happened to glance at the clock and we're almost to the top of the hour. So I just want to remind the audience that if you've got any questions or comments that you'd like to address to our 3 panel members, by all means, let's do that. What I'd also like to do, because you brought up assisted living and memory care, and I hope I'm not putting anybody on the spot, but Susan, if you want to jump back on the conversation, I wanted to ask you, before you went behind the curtain, how things are going at the Kensington and Reston, and it would be great to sort of add you to the panel so that we could learn more about this new and exciting project that's literally right down the street from where I'm at right now in Reston. So while Susan's coming on, and we'll see if the audience would like to throw anything in, but what I'd like to do is just turn it back to you panel members on some closing thoughts and words of wisdom that you might share with our audience out there. Susan, I always love to hear your words of wisdom. So you want to jump in and give us some insights?
Which Susan?
Oh, Susan Rannick, you.
This has been a little confusing. My apologies. I'm happy to. My words of wisdom are this: TTS, target the smile. Don't forget the smile. It's all about quality of life.
That's fantastic. Vanessa, any thoughts that you'd like to share with our audience as we wind things down?
That there's no shame in asking for help. It's truly a team approach. Everybody is evolving and changing over time, so we must reassess and adjust and balance ourselves. And it's okay, again, to ask for help.
Very good. And as we jump back to Dr. Sinha, I knew a question was going to come in and Jennifer Brown asks, Dr. Sinha, your thoughts on the issue of allergic reactions to the vaccine and the issue of folks who carry EpiPens. Any insights on that?
Sure. So, obviously you should speak with your provider. One of the contraindications for the vaccine is anaphylactic shock, not an anaphylactoid reaction, which there's a difference. So if somebody has had an actual anaphylaxis shock where they've gone into shock and they need an EpiPen, then at this time right now, it's recommended that they hold off until a little bit more studies are done.
Great words of wisdom. Okay, great. Well, the I have to say, I've really gained a lot of insight that I can definitely share with my family, but with those calls that we get at Positive Aging Sourcebook, because it seems like every day I'm talking to folks that are, really facing some challenging decisions, and we've got no roadmap. And so all we can do is just listen to those around us, share ideas and resource with other folks, try to remain objective. I really like going into conversations with "I love you," "I'm sorry," and "thank you" in the back of our mind. And since we're nearing the top of the hour, Susan Garvey, you want to jump on and join us?
I do, Steve. Thank you so much. And thank you to all our panelists in these wonderful discussions. We are very excited. We have moved into our new community on Sunrise Valley Drive, and our models are open for people to come see us. We are part of a journey that all of the people that are on this panel are involved with us. This is a search. This requires asking questions. Sometimes you don't know the questions to ask. And I just want everyone to know that we at the Kensington are here as a resource. We really are here to walk you through, to talk it through with you, and to show you our way of doing things. Our Kensington Falls Church has been active for 3 years, and we plan to open our doors the 1st of March. But our doors to our neighbors and friends and people that are interested are open right now and through the holidays. So I just want to thank all of you again for joining us, and for all the people that participated in this lunch break. And to let you know that on January 21st, Dr. Sinha is going to continue the conversation at 6 p.m. It's going to be a webinar again, so it doesn't matter what our weather is, another time. And hope we'll look for more information on our website about that. But happy holidays to everyone. Happy, healthy new year to everyone. And thank you for joining us.
And Susan, I'm not going to let you shut things down that quick, because we got another question for Dr. Sinha, but I also want to dive a little bit deeper into the Kensington and Reston. So just how many residents is this community can live in this community, and what is the, I believe is it memory care exclusive or assisted living and memory care?
So we are a boutique senior living community. We have a license and permit for 105, but figure we'll have about 95 people with us. We have assisted living as well as 2 levels of memory care. So the mild to medium cognitive issue, and then the more acute. All together, we want to keep people together. So if spouses, loved ones want to live together, although they're aging differently, that's fine with us. Your pets are welcomed as well. We have the highest quality of excellence 7 days a week. We are all working so that Saturday is no different than a Tuesday, which is no different than a Friday, which makes us unique in that as well. And it's just a beautiful, engaging, wonderful, surrounded community. Our mission is to love your family as we would love our own. And that comes through the minute you walk in the door. I think you'll feel that. And anxious to show people around. We have a wonderful team that's here to answer questions and take tours and be out in the community as well. That's the Kensington model. We have just finished our season of giving. We have 42 seniors that we are providing gifts for, and we provided 165 pounds of food for the South Lakes High School. So
Great.
we're out in the community and we're open. So come see us.
Excellent. And then we got another question that came in for Dr. Sinha, and this is a good one. Audra asks, if a family is visiting, do you suggest COVID testing beforehand? So if somebody said, I am going to go visit mom, I don't care about any of this, you get a test beforehand, when do you do it, and how do you evaluate the results of that?
Sure. The safest way is to quarantine for 2 weeks and to not have symptoms, to make sure you're not having symptoms, because that's really the only way you can pretty much get to as close to 100%. Having said that, testing, usually with a PCR test, is the best way, either once or twice throughout that 14-day quarantine. But the CDC does recommend that by far the best way is to simply quarantine, because symptoms should present at some point within 14 days. And if they don't present, then you should be okay.
Okay, good reminder. And if I guess if your plan is to visit mom on Christmas Day, you should have been quarantining for a week ago.
and testing does help, but
yeah.
But the safest way is to quarantine.
Yep. So, well, great. And it looks like this clock is striking 1. And so Susan and the team at the Kensington, thank you so much for putting this together. And thanks for inviting me to be a part of this panel and moderate. I definitely learned a lot today, and I'm going to carry that forward. And thanks everybody on the panel, Dr. Sinha, Vanessa, and Susan, for your insights. And I'm sure that the Kensington will follow up with everybody and provide contact info and a recording if you'd like to share this with your friends, family, and loved ones.
Absolutely.
Thank you.
Great.
Thank you.
All right. Well, thanks everybody.
All right. Happy holidays. Take care.
Happy holidays.
Take care. Happy holidays.